And let's talk about diastolic dysfunction. So diastolic dysfunction is a type of heart failure where the heart does not relax as it should. So it's a little bit stiff is what we refer to it. And there's a couple treatments for that. One of them is Farxiga. Farxiga has the indication for diastolic dysfunction for the treatment of it, and it can help with that stiff ventricle. And so keep that in mind, that if you're using this medication, that you should be careful about looking for signs and symptoms of complications from Farxiga. What I always coach my patients is Farxiga makes you pee out 70 grams of glucose or carbohydrates. So if you're not aware of that, for my women, I'm worried about UTIs and yeast infections. For men in general, if you're circumcised, the risk of a UTI or yeast infection is minimal at that point. Just keep that in mind, and you'll read some bad things about the serum glucose transporter 2 inhibitors such as Farxiga or Jardiance, that there was genital necrosis. And if you're not keeping clean down there, showering, and you're using these medications and taking them every day without reevaluating your symptoms, that's when you get those type of complications. But if you're keeping the area clean after you urinate, then you don't have to worry about genital necrosis and so forth. But it's a wonderful medication. Farxiga and Jardiance, or the serum glucose transport 2 inhibitors, are wonderful medications that have been shown to decrease mortality in stroke. They're great for diastolic dysfunction. At least Farxiga has indication. That's something to keep in mind. And it also causes weight loss because you are peeing out 280 carb calories every time you use those medications. So you got to be careful with it. I hope this helps. If you're on that medication, be on the lookout for those signs and symptoms. And what I always tell my patients is, if you don't feel good in the morning and you suspect your carbs might be low, you're sick, then you should stop that. But always talk to your prescriber, your physician, who's ever in charge of it. And I'll see you at the next video. Tubby Doc out.